All right, if you're studying for an exam, you know that just memorizing facts isn't going to cut it. You've got to understand the why behind a disease process. So today, that's exactly what we're going to do. We're not just going to list symptoms of renal failure, we're going to build a visual map of the entire journey, starting with a healthy kidney and following the path all the way to dialysis. Let's trace it together.
First, we'll cover the kidney's absolutely vital baseline functions. Then, we'll jump into what happens when it fails suddenly with acute kidney injury. After that, we'll look at the slow, quiet path of chronic kidney disease, see how that failure affects the entire body, and finally, we'll explore the life-saving intervention that is dialysis.
Okay, so before we can even begin to talk about what goes wrong, we have to appreciate what's going right. What exactly is this powerhouse, the kidney, doing for us day in and day out?
Well, it all comes down to this incredible, microscopic little structure, the nephron. Seriously, if you think of the kidney as a giant factory, the nephron is the individual worker on the assembly line. And get this, you have about 1 million of them in each kidney, just constantly filtering your blood.
So let's follow the path. First, blood gets forced through the glomerulus. Think of it like a tiny sieve. Everything that squeezes through is now called filtrate. This liquid then takes a journey through all these winding tubules, and as it travels, really important stuff like water and electrolytes are pulled back into the body, while all the junk, all the waste, gets left behind. What's left at the very end of this process? Well, that becomes urine. But here's the thing, the kidneys are so much more than just fancy filters. They are master regulators, and honestly, one of their most critical jobs is managing your blood pressure. And they do this through this really elegant feedback loop called the renin-angiotensin-aldosterone system, or RAS for short. So if your blood pressure dips too low, the kidneys sense it and release something called renin. This kicks off a whole chemical chain reaction that ends with angiotensin II squeezing your blood vessels tight and aldosterone telling your kidneys to hang on to salt and water. What happens when you have more fluid in the pipes? The pressure goes up. It's a beautiful, self-correcting system. That is, until it isn't.
So what happens when that system doesn't just slowly wear out, but instead it fails suddenly and dramatically? Well, that's when you're looking at acute kidney injury, or AKI.
The causes of AKI really fall into 3 main categories, and here's a simple way to picture it. Pre-renal is a perfusion problem, an issue before the blood even gets to the kidney, kind of like a king toes. Intrarenal is a problem inside the kidney itself, like the filter is physically damaged. And post-renal, well, that's a plumbing problem after the kidney, like a clog in the drain.
Now, AKI usually plays out over 4 distinct phases. Right after the initial injury, the oliguric phase kicks in. Oliguria just means very low urine output. The factory's basically shutting down. If the patient can weather this storm, they enter the diuretic phase. Here, the kidneys start to sputter back online, but they often overcorrect, producing massive amounts of very dilute urine. And finally, there's a long, slow recovery phase that can honestly take up to 2 years.
Understanding the labs in that oliguric phase is absolutely critical for exams. I mean, think about it. If the kidneys are offline, where does everything go? Waste products like BUN and creatinine start piling up in the blood. Potassium, which the kidneys are supposed to get rid of, shoots sky high. Fluid has nowhere to go, so it backs up, causing fluid overload. And the body can't ditch acid anymore, which leads to metabolic acidosis. See? Every single one of these is a direct consequence of the kidneys not doing their job.
But what if the failure isn't a sudden crash? What if it's more like a slow, silent decline that happens over years and years? Well, that brings us to chronic kidney disease, or CKD.
CKD is staged based on something called the glomerular filtration rate, or GFR. It's just a fancy way of measuring how well the kidneys are actually filtering. And here's the really scary part. In stages 1, 2, and even into stage 3, most people have absolutely no clue anything is wrong. The symptoms often don't show up until about 75% of kidney function is already gone, permanently.
And when you lose that much function, the consequences are felt everywhere in the body. This isn't just a kidney problem anymore. It becomes a full-body crisis.
This quote really says it all, doesn't it? The failure of this one organ system sets off a devastating domino effect that ripples through every other part of the body. Let's really visualize that cascade. First and, without a doubt, most dangerous is potassium. Remember how healthy kidneys get rid of extra potassium? Well, when they fail, potassium levels start to climb. This is called hyperkalemia, and its most immediate and deadly effects are on the heart. You can literally see the danger of high potassium on an EKG. It starts with these tall, peaked T waves.
Then, as the potassium level gets even higher, the QRS complex, that big spike that represents the main squeeze of the heart, it starts to get wider and wider. This destabilizes the heart's entire rhythm, putting the patient at huge risk for fatal dysrhythmias. And that is exactly why these patients need to be on a continuous heart monitor.
Okay, next up is this toxic relationship between phosphate and calcium. You see, failing kidneys can't get rid of phosphate, so its level in the blood goes up. The problem is, high phosphate forces calcium levels to go down. The body senses this low calcium and panics, trying to fix it by pulling calcium from the only storage bank it has, the bones. Over time, this leads to a condition called renal osteodystrophy, which just means their bones get super weak and can fracture easily.
But oh, it doesn't stop there. Patients become anemic because the damaged kidneys stop making erythropoietin. That's the hormone that tells your bone marrow to make red blood cells. Their blood pressure gets worse and worse from all the fluid overload. And as those waste products keep building up, they can even start to come out through the skin as little crystals, causing this horrible, intense itching. You can really see how it's all connected, right? One system fails and it just starts a cascade.
So this brings us to the end of the line. When the kidneys have failed completely, we need a way to do their job for them, from the outside. And that's where dialysis comes in. To do hemodialysis, you need a reliable way to get to the patient's blood. This is usually done with a surgically created AV fistula or a graft, which basically connects an artery directly to a vein. Now, for any nurse, the #1 assessment here is to feel for the thrill, which is like a buzzing vibration, and listen for the brute, a whooshing sound. That thrill and brute are your proof that the axis is open and working correctly. So let's run through the absolute must-know nursing priorities. You have to think about what the treatment is doing. It's pulling off fluid and filtering the blood. So it makes sense that you'd hold blood pressure meds beforehand to prevent their pressure from crashing. You're going to weigh the patient before and after to see exactly how much fluid came off. And most importantly, you protect that access arm like it's gold. No blood pressures, no IVs, no nothing. That arm is their lifeline. So we've traced the entire path, from a single healthy nephron all the way to the artificial kidney. We've seen how this incredible technology can step in and replace a vital organ's function, fixing all those deadly imbalances we talked about. But this treatment also completely reshapes a person's life. And that leaves us with a final, really important question for anyone in healthcare. How do we help our patients navigate that tricky balance between a treatment that keeps them alive and the quality of the life they're living?